Dr. Wen, it's so nice to see you.
It's nice to see you, Risa.
Thank you so much for joining me today. Today's topic is going to be quite important, actually, because there's so many people who are dealing or know someone who's dealing with cancer, and how TCM, which is traditional Chinese medicine, and acupuncture and herbs can really help with a lot of the side effects. And I know you've worked with a lot of cancer patients before, as well as many other patients who have had a lot of different ailments. But I would love for you to share with the audience before we kind of get into the meat and potatoes, as they say, of the interview, a little bit about you, where you're from, how long have you been practicing, where do you practice, and what do you love about TCM?
It's a loaded question, right?
Yes.
It's a lot of things. So I graduated from Beijing University of Chinese Medicine in Beijing. So that the program I was in, that was like a 6-year program, like half for conventional medicine and half for Chinese medicine. So the goal is to train integrative medicine practitioners. And so after that, so I did my residency. At the same time, I enrolled with the master program, clinical integrative medicine. And so that was 3 years. And after that, so I worked at the emergency department in the hospital, teaching hospital, Dongzhimen Hospital in Beijing for 3 years before I came to the States. And so I've been teaching local acupuncture college, well, have a private practice, since then. In my practice, I have been dealing with a lot of patients with cancer, and mostly it's the side effects from chemo treatment and other treatment.
So you were actually helping cancer patients in Beijing?
In Beijing, that was in the emergency department. It's like not a major part of it. But I have seen that a lot already. And also, even back then, using Chinese herbs and acupuncture is, part of the practice, to help the cancer patient. But since moved to the States, well, I was teaching, and I also see a lot of patients, suffering from that. And so the idea is to help the patient to regain their strength faster, and to help them to make the suffering less. That was always the goal. So in short term, right? Yeah, quality of life is always being the goal actually for TCM, like in supporting the cancer patient recovery.
Right. Well, how long have you been practicing here in the U.S.?
Since 1995. So it's so like 30 years, because this year is like also my 30 years of anniversary of teaching at the school.
Wow.
USAN University of Chinese Medicine in Los Angeles. And
That's
so
amazing.
well, time flies. Yeah, you just look back. Wow, this has already been 30 years. Yeah, so a lot of my students are practitioners all over the states, and so they're definitely, in terms of to promote TCM and to help patient to get better. Yeah, they're there. They're but there's still a lot of work needs to be done, to help people.
So, not all cancer is the same, but a lot of the treatment is similar. In Western perspective, a lot of them, depending on what kind of cancer, is either radiation or chemo, with, a lot of medications and stuff. So how does TCM approach cancer and Western treatments?
Cancer is a very complicated problem, right? So that's why there's not a single, people always try to find a single, silver bullet, to cure it. But, it's a multifactorial. There's so many factors involved. So that's why the cancer treatment is always so-called like a comprehensive. Yeah. And chemotherapy is one of the oldest approach. Yeah, from like probably 1940s, even to today, it's still a very big part of it. Even though the immune therapy, target therapy, and a lot of new approach, coming along, but chemo still remained as one of the major approach to use.
Why do you think that is?
Because chemo, in a way, is a very like strong approach to kill cancer cells from the root. We're talking about like to destroy. If you look at the mechanism of chemo treatment, it's like, okay, you may kill the cancer cells because you stop the DNA from reproducing. Yeah, so the cancer cells cannot grow. But by the same token, chemotherapy also damages the normal cells, indiscriminatively. So that's why the side effects from chemo treatment can be long-lasting. Yeah. So based on the medically speaking, they have the short-term side effects, they have the long-term side effects from chemo, and a lot of those damage from chemo is basically the damage to the normal cell, normal tissue. And in conventional medicine, so sometimes we don't have a way to like actively help to restore the normal balance, the normal function of those tissues and organ system, damaged ones. And in Chinese medicine, TCM, the goal from the very beginning is to keep the balance. Like we have terms like why people get sick in TCM, right? Your righteous qi, which means the body's resistance to disease, which include immune system, include your normal zangfu function, versus what we call that the evil qi, the pathogen. So it doesn't matter wherever the pathogen is from. Could it be from the outside, could it be from the internal, could be from nowhere. Sometimes you cannot even identify. So it's always about that like battle between the righteous qi and the evil qi. If the evil qi wins, you're sick. If your righteous qi is always like one step ahead, you're fine, you're okay. So
You're talking about qi, like Chinese qi.
like Chinese qi, yeah. Qi is like, there's so many different translations we have. One, I think, is still like there's not a one perfect translation, but one is called the vital energy. I think that is still very close to the meaning, the original meaning in TCM. Yeah, and so you can interpret that into like a normal immune system or balanced immune system or normal like organ system, organ function, and you can interpret it different ways. But that is basically it's like okay, you have to keep your righteous qi up, and then you'll be able to protect the body and prevent from getting sick. So, and all the practice we're talking about, like Chinese herbs, like acupuncture, and even like Tai Chi, the other exercise, Qi Gong, and even food, the goal is very clear, to basically strengthen your righteous qi to make the body stronger, so you'll be able to handle whatever the pathogen you may encounter. So in that sense, it's like we have a very established, mature approach to strengthen the body's normal function, to help restore the organ function. So that's why it's a perfect match. So after chemo, if you can help to restore the body's function, the body's immune system is better and they can function better.
So does acupuncture and using herbs, Tai Chi, whatever it may be, do you recommend if someone's been diagnosed with cancer to start treatment before you even start chemo or radiation? Or is it kind of once you've had the chemo, once you've had radiation or whatever Western treatment, then TCM comes in afterwards to try to help with any of the symptoms that you might be having, the side effects.
Very good question. Is actually the sooner the better. The sooner the better. Before they even start chemotherapy, because there's a room time for you. And normally, when people get diagnosed, and so between the time they get diagnosed and also the time they start chemotherapy, a few weeks. So for some people, that's a very crucial period of time. If they're already very weak, we know chemo can be very strong, very harsh. So if you can use that time to actually strengthen the body to prepare for the treatment, they can definitely benefit more. But we do have patients they cannot come every single time. This is they get diagnosed, they just jump to acupuncture clinic. They cannot do that. But they already had a couple of rounds of chemotherapy, so they have first-hand knowledge what's happening. And then they come, we get started with the treatment, and round 3, round 4 chemo, it's this is not a typical chemo treatment because I don't experience the same. They can see the big difference. Yeah.
In what way? Like, what kind of differences have your patients seen after receiving acupuncture? And
we talk about the typical side effects from chemotherapy. You have the fatigue. Yeah, that can be a result from the bone marrow suppression. Yeah, some chemo drugs that can do that. And there's the GI issues, nausea, vomiting, diarrhea, no appetite. Yeah, and they have also, if after a couple of rounds of chemo treatment, some patient may experience a thing we call that chemo brain, because the brain also can be affected by the toxins. So for the patient, they probably feel they don't have good energy, they don't feel good, the gut is hurting. So those issues all can be addressed. Yeah. And so if you have better energy, if you can sleep better, if your mood is better, if you can eat, you can digest, they can tolerate the treatment much, much better. Yeah. So that is pretty much the goal.
is there kind of a standard protocol in terms of cancer treatment, or do you customize it depending on the patient? Does it matter what type of cancer do they have and where it is in terms of the way you approach the treatment, or is it pretty standard?
Actually, it's like a little bit of both. We have standard protocols. Yeah, if basically it's it doesn't matter what type of cancer at the very beginning. It's what type of treatment they have. This particular chemo or that chemo mostly impact the bone marrow or the GI. So you can actually, that's why if you start early, we can target those areas to prevent that, to strengthen this area to make sure they have less damage. And so after that, there's also individualized questions, because in TSM, the ideal treatment is individualized treatment and personalized treatment. So based on your personal constitution, means genetics, and your past history of medical conditions, and so everyone come into this with a different background. Yeah. So there room you need to modify, but there's also general protocols we can use.
And do you also prescribe herbs, or is it generally only acupuncture?
Most times it's acupuncture and herbs, because they serve for different things. Yeah, acupuncture, two things at least we're talking about. For the mood, right? Sleep issues, and also because we know acupuncture help to release endorphin, the dopamine. So endorphin is pretty much serve like a more natural painkiller. And some cancer patients, they have pain, and dopamine is more like a mood, modulator, So basically mood lifting. So every single patient, they can benefit just from the acupuncture per se. And if you have a particular problem, for example, like chemo-induced neuropathy, peripheral neuropathy, and tingling, numbness of the fingers and toes. Yeah. So acupuncture probably even be more effective because we needle it right on where it hurts the most. Yeah. So to help reduce the inflammation of the nerve and to help to restore the balance, yeah, of the nerve. Yeah, that is the acupuncture part. And so the herbal part is depends on what they need. Yeah, so they may need a little bit of push for the bone marrow growth, or they may need a little bit push help to stabilize the gut. Yeah, and some is just like need a little bit push for the energy. Yeah, so they have a different purposes.
Wow. So is acupuncture then as a side benefit? Is it helping? So it's not only helping the side effects, but is it also ever helping treat the cancer itself, or not necessarily?
Not necessarily, but we know cancer is a part of like our own tissue. Yeah, we use the analogy, good kids gone bad. So they're not foreign. They're actually part of our own system. Yeah. So that's why, the idea is like to eliminate, to kill them all. It's not always realistic and not possible. And so the new consensus right now is like to live with cancer. They're like, okay, make cancer become more like a chronic disease, like hypertension, diabetes. You can manage it. You can just live it. That's like I see that a lot also in my practice. Patient, stage 4 lung cancer, 8 to 9 years, to just live with it. Yeah,
Really?
yeah. Well, that's not kidding. Real. Yeah. And so they can. Yeah, they can. So this is pretty much the trend. So if you can strengthen the body, the immune system, you can make the system is just strong enough to live with a little bit of remaining cancer. That's probably before we find the cure. Yeah, and that's probably the second best. Yeah, solution. Yeah.
Wow.
And so that's why when you do, we're talking about like a lifestyle modification, and you're talking about the prevention. And in TSM, the prevention is always the goal. If you can prevent something from having a disease, it's always better than to treat that disease. So that's why there's so much focus on like the lifestyle modification. So you need the measurement we have. Okay, your sleep quality, your energy level, your gut balance, right? You pretty much your mood, your emotion, they should be balanced. So that is always been the focus, in TSM.
Wow, so interesting. And how do you also treat patients who are having radiation?
They have for patients have in TSM, we talk about like chemotherapy is more like what we call like a cold toxin attacking the system, because based on like the response from the patient, they feel cold, they feel fatigued, they're tired, they have diarrhea, they tend to be, and also a lot of cancer patients with chemo, you can see that the chemo look, right, very grayish, very sometimes very pale. And on the other hand, the radiation therapy. So normally what you see is like the area they just had radiation therapy tend to be the skin is irritated, red, sometimes it's super red, inflamed. So radiation is considered as what we call like a heat toxin affecting the system. So the treatment is a little bit different. The protocol is a little bit different, but it's the same. Acupuncture and herbs can definitely help both. And with the skin irritation, sometimes we use like herbal soak, different one to help, reduce the inflammation, to help the skin to, repair. There are other ways. Yeah. Mm-hmm.
Would you say, is there a ideal candidate for acupuncture and TCM when you have cancer? Is there a certain type of constitution where you feel like it's most effective, or it doesn't really matter? Like what, because everybody's so different, right? You have different age, weight, gender, diet, lifestyle. I mean, yeah, and the disease, of course, is also very complicated, and can happen anywhere in the body.
Yeah, in general, actually, I think all cancer patients can benefit from the TCM treatment. It's just a matter of like how much. Yeah, some patients you may need more. Yeah, other patients may need less. So, for example, like we have chemo treatment. Yeah, so based on the TCM like principle, so you kind of like have the interesting phenomenon when patients come in, you look at, oh, they're about to have chemotherapy. So you pretty much can predict they're going to have a tough time or they're going to have a relatively speaking easy time. The reason I say that is because remember we were just talking about chemotherapy is like a cold toxin invasion. So when your body, tend to be on the heat, on the hot side, you have a lot of like excess heat. So you can actually, the body can neutralize some of that cold toxin. So you may not have a very bad reaction from the chemo treatment. But on the other hand, some people, they tend to have cold presentation already. They tend to be weak and cold, they have like a very poor digestion to begin with. And what we call in Chinese medicine, they have those like deficiency cold type of pattern. So you can pretty much predict that they'll have a rough time to go through this because you already have a cold presentation. And on top of that, you add more cold toxin into the system. So that's just like a double whammy. You just don't feel good. Yeah. So we have that type of prediction. You can see when you see the patient.
And how long does it normally take for the patient to start feeling relief from the side effects after having a TCM treatment?
Oh, some patients right away, like the nausea, they have like, you have the treatment just right away, just right after. And most of the cases doesn't take long. Yeah, you can see it's like, it's not, okay, you wait for a month and then you see some improvement. It doesn't work that way. So your body, this is the difference between TCM and conventional medicine. And so in TCM, when you stimulate, when the qi is circulating, treatment is right, you should feel right away.
There's always skeptics, right? They're all people who are like, no, there's no way that it could work, or I tried it once and nothing happened. What do you say to people like that are skeptical about the efficacy of acupuncture and herbs and TCM in general?
Well, there's so many also factors involved. The practitioner, you see what type of training background they have, or how much experience they have, and their technique. This is normally, that's why I always tell my students like, okay, you better do a good job. Don't scare your patient away. If because if your technique is rough and patients that don't like it, they may not come back. Yeah, that is one. And also the other, the TCM is being around for at least, we talk about 3,000 years. All those like herbs and the acupuncture itself, I call that, this is the largest actually human experiment. Yeah. So like the formula I'll talk about, okay, what do you need? We need you're taking steroids, right? You're on chemo. So you cannot tolerate that steroids. So patient always ask, do you have anything you can offer? It's like, yes, I do. I have this formula, 1800 years old. We call that herbal steroids. If you want, you can benefit from steroids. You can benefit from this one. Yeah. So a lot of stuff like people say it's like a mood. I don't feel good. I'm depressed. And, do you have any? I don't want to be on like antidepressants. Do you have anything similar? We do. We have what we call herbal Zoloft. Yeah, it's also 1800 years old formula. You can, those formulas are not just because they're, they lived so long. And a lot of those studies actually showing pretty much why, those formulas are working, because they fit in perfectly with the pharmacological studies. Yeah. And anything you can think of, we have a herbal version. Yeah. And because this medicine is being around for so long. And
Yeah,
only
and
one
there's
thing,
hundreds of Chinese herbs also, right?
yeah, yeah. One thing I need to also remind, the patient is like, if you're taking chemo right now, what we don't want to do is like, because there's a small group of herbs, we call that herbal chemo, because those herbs, they have anti-cancer properties, they act like chemo. Yeah. This is like the before chemo, invented. This is the kind of like the herbal chemo treatment, yeah, from history. So if you already taking chemo, so we definitely not to add that group of herbs into, yeah, your treatment. So make sure you talk to the oncologist, and we can check with the oncologist, like, okay, what you're doing is we basically to support the gut, support the bone marrow, to balance the nerves, not to interfere with chemotherapy. So that is a very, and whoever your practitioner give you, and while you go through chemo treatment, so make sure check with that. So like, okay, because that's the that is the part that there may be potential, yeah, interaction, yeah, maybe potential adversary effect. That's all.
Right. So if someone has cancer and they're looking for a TCM practitioner to help with their Western treatment, what should they be looking for? What kind of questions should they be asking to make sure that it's a good fit? And is it something where they should be looking for an oncologist who works with an acupuncturist already? Because I think that there's like Mount Sinai, for example, in New York, they have acupuncturists on staff now. I don't know, is that becoming more common?
It's more, yeah, it's coming. It's more. You see more of those like oncology group. They have acupuncturists, on staff, or they have someone they work with. Yeah, some of them doctors I work with is like they know you. Of course, they're more open to this. But for anyone who is thinking about to get some treatment, I think the number one question is like, okay, you need to make sure the practitioner is licensed. We have in pretty much, yeah, in like in California, you have the California state board for regulating acupuncture practice, and like in New York and other states, you have the national certificate. So number one is like make sure that, because that is to get the license, you have to go through a very lengthy training program. Like the college I'm talking about, I've been teaching now, about like 4 years, yeah, training. So they have the experience, so that you can trust, they're at least they're able to do the real treatment. Yeah. And so most of the patients, of course, is also, from the referral, from, their relatives, their friends, whoever, they had, if they're not, yeah, open to it, so you can just ask around, and yeah, so at least you can have some second-hand experience. Like, okay, this practitioner is capable and is good, so you can try.
Right, right. So important. And the whole licensed acupuncturist practitioner is so critical because technically they shouldn't be practicing at all if they're not licensed. And I think that there are, I find that many acupuncturists, I've been interviewing a lot of acupuncturists, and everybody does have their own style, their own approach. It's the same thing with Western doctors or any kind of field, to be honest, right? Everybody has. So I think it's important to find somebody you trust and somebody with the experience, like you were talking about, right? And with the
Yeah.
knowledge base that they really need to be able to treat something like this. So if you're getting treated with chemo or radiation for your cancer, how often should they be getting their acupuncture treatments?
Most the patient, when they go through chemo, they have this very interesting phenomena. It's like they either day 2 after the infusion, the chemo, day 2 or day 3, there's the worst day. Yeah, they're the most exhausted, they have all the symptoms. So the approach normally we do is like you can compare. They already had that experience. So what we do is like the day before the chemo, we start having the treatment, and then they can feel, yeah. So seems like there's less. It's not as severe. and then we'll do another treatment probably after, like 2 days after. So used to be day 3 is the worst day. You do treatment at day 3. So to see if that will be enough to lessen the reaction. Yeah. And so when they're stable, because they're not on chemo all the time. So normally, once a week, is on average, it's pretty much good. Yeah, because it's basically, it also depends on how your body respond to the treatment. Yeah, and like I mentioned, acupuncture is basically to release endorphin dopamines. You afterwards feel so good, so energetic, and day 2, day 3 is like, feel very lethargic, don't have enough energy again. So we always say, you may need a second treatment, so that will help you go a little bit longer. And also the endorphin dopamine released from the treatment, they also accumulate. So over time, it's like one treatment is enough to keep them going for 2 weeks, or sometimes even longer, 3 weeks. So it's not like, you have to come in like every week or every other day. It doesn't work that way.
Yeah. And so it's kind of, we're going to wrap this up soon, but I just wanted to ask, like, in your experience, what kind of misconceptions or what kind of questions do people ask you where you're like there's a lot of unknowns for most people around TCM and acupuncture. What are some of the misconceptions that you find people have?
A lot of times it's like they're worried, from patient perspective, they're worried, okay, well, the treatment, like especially like herbs, will that be interfering with the chemo treatment? That is a very common question. So that's why I always, tell patients upfront, what we do, what we have, this is not the chemo, the herbal chemo, it's nothing. It won't be interfering with the chemo treatment. That is always. And the second is always like, okay, I need, so like my oncologist may not approve this. They're like, we're open. We need to talk to your oncologist. The thing is that if every treatment that you have from the conventional practice, you're good, you probably don't need us. Yeah. But if that's not enough, the fatigue is just not going away, the nausea is just persistent. When you have the neuropathy is just burning like crazy. When you have that, you should think, give it a try. Yeah. So after all, the acupuncture probably, it's very natural. Yeah. And it's basically to stimulate your own system. Yeah. So it's your own system working. It's not that you don't have to depend on something. Herbs, if you use it right, can be like miracle. So we have a lot of patients that are very satisfied, from the combination.
Wow, that's amazing. I mean, it's just such a gift, right? To be able to have those options. And that's part of my mission, right? To let people know that there are other options available. And the more they educate themselves, the more they know, essentially. So if people want to follow you or get in touch with you, or do you have a website? How do they get in touch with you if they have questions or perhaps, want to make an appointment with you?
So they can go to my website. It's www like wenacupuncture.com, like my last name, WEN acupuncture.com. Very easy to to remember. And so if they have questions, they can just check, get on my website, and also call my office. And if they're interested, if they're out of state, we do like a herbal consultation for patients out of the state. If they're not in California, not in Los Angeles. And so that's the most important thing is like the patient, they should get the help they need. And they can be helped. I think that is the most important part.